you have noticed them appearing. Small, soft growths on your neck, under your arms, along skin folds. One became three. Three became a dozen. Your blood work came back normal. Your doctor glanced at them and said nothing significant. And yet something is clearly changing. Here is what nobody in that appointment told you. Those growths are not a skin problem. They are an immune system problem. And after 60, the reason they multiply has everything to do with what is happening inside your body, not on the surface of it. By the end of this video, you will understand exactly why this is happening and the 3 highest impact changes you can start this week to slow it down. I'm Dr. Chandler. I study age-related changes in immune function, specifically what happens to the body's defense systems after 60, and how those internal shifts show up as visible symptoms. Research published in the Journal of Nutritional Biochemistry has confirmed that zinc deficiency, one of the most common micronutrient deficiencies in adults over $60, directly impairs T-cell function and natural killer cell activity, 2 of the primary immune mechanisms that keep HPV under control. HPV, the human papillomavirus, is the virus behind the vast majority of skin tags and warts. And after 60, your immune system's ability to suppress it changes in ways most people are never told about. Here's what concerns me most about this. Most people see new skin growths appearing after 60 and assume it is just cosmetic aging, something to manage with a dermatology appointment or ignore entirely. What they do not realize is that every new cluster of growths is a signal from an immune system that has lost some ground. And the longer that signal goes unaddressed, the more the underlying immune decline progresses, silently in ways that go far beyond your skin. Skin tags and warts are the visible part. What is happening underneath is a broader weakening of your antiviral defenses. The skin is just where you can see it. The human papillomavirus, HPV, is extraordinarily common. Health agencies estimate that the majority of sexually active adults will encounter it at some point in their lives. Most people carry HPV subtypes associated with benign skin growths, soft tags, common warts, without ever knowing it, because a healthy immune system keeps the virus suppressed at the cellular level. The virus is present. The immune system simply does not allow it to produce visible changes. After 60, that balance shifts. Not because you encountered a new virus, because the immune system you already had lost some of its suppressive capacity. The virus you have been quietly carrying for years becomes bolder, and the result shows up on your skin. Understanding this distinction changes everything about how you approach the problem. You are not fighting a new infection. You are restoring a balance that has gradually tipped. A 2021 review in Immunity and Aging confirmed that immune senescence, the age-related decline in immune cell function cheese, is directly associated with increased susceptibility to HPV-related skin manifestations in older adults, particularly after the 6th decade of life. Before doing anything to the surface of a growth, ask yourself this: has my immune system been under unusual stress in the last 1 to 2 years? A period of poor sleep, significant emotional stress, illness, or major dietary change often precedes a wave of new skin growths. The timing is not coincidental, it is mechanistic. Now, 3 internal systems determine whether your immune cells can keep HPV suppressed, and all 3 change in specific, addressable ways after 60. Zinc is a trace mineral that your immune cells depend on for growth, signaling, and repair. T cells and natural killer cells, the 2 primary immune mechanisms that keep viral infections like HPV under control, require zinc at every stage of their function. When zinc levels are adequate, these cells activate quickly and efficiently. When zinc is low, their response slows and weakens. After 60, 2 things happen simultaneously. First, the gut absorbs zinc less efficiently than it did at 40I, a well-documented age-related change in intestinal function. Second, many seniors eat diets that have drifted toward convenience foods and away from the zinc-dense whole foods, seeds, nuts, seafood, quality meat, that were once routine. The result is a slow, gradual zinc depletion that standard blood panels often miss because serum zinc does not accurately reflect cellular zinc status. Research from the journal Nutrients published in 2020 found that zinc deficiency affects an estimated 30% of adults over 60 in developed countries, and that supplementation or dietary correction in deficient older adults measurably improved immune cell activity within 8 weeks. The single highest impact food change you can make this week is adding a small handful of raw, unsalted pumpkin seeds daily. 1 ounce provides approximately 20% of the recommended daily zinc intake for adults. Eaten consistently, this is one of the simplest and most affordable immune corrections available. Add them to breakfast, a salad, or take them as an evening snack. Zinc addresses the cellular fuel problem, but there is a second system that determines whether those immune cells can even reach the sites where HPV is active, and it lives in your gut. The intestine is one of the largest immune organs in the human body. The mucosal tissue lining your gut wall houses an enormous concentration of immune cells, T cells, natural killer cells, immunoglobulin-producing B cells, all positioned to respond to pathogens encountered through food and the environment. When the gut lining is healthy and the microbiome is diverse, these immune cells are well-regulated, well-nourished, and responsive. When the gut is inflamed and the microbiome is disrupted, immune regulation breaks down, and the downstream effects are felt throughout the body, including in how effectively your skin's local immunity handles HPV. After 60, microbiome diversity tends to decline naturally. When that decline is accelerated by high sugar intake, refined carbohydrates, low fiber, and long-term use of acid-suppressing medications, a combination extremely common in the U.S. senior population, the immune consequences compound. Research in the journal Gut Microbes has documented a direct association between reduced microbiome diversity in older adults and impaired mucosal immune responses to viral infections. 2 specific additions to prioritize: naturally fermented foods and dietary fiber. Sauerkraut, not vinegar pickled, but naturally lacto-fermented, provides live lactic acid bacteria that support microbiome diversity. Add 2 to 3 tablespoons at lunch several times a week. For fiber, replace refined carbohydrates at breakfast with rolled oats and 1 tablespoon of ground flaxseed. The combination of soluble and insoluble fiber feeds beneficial gut bacteria and supports the short-chain fatty acid production that strengthens the gut immune barrier. Zinc feeds your immune cells. Gut health determines whether those cells function optimally. But there is a third factor that can override both of them, and it is the one most commonly overlooked in senior health conversations. When you live under sustained psychological stress, a serious illness in a family member, financial pressure, prolonged poor sleep, grief, your body produces elevated levels of cortisol, the primary stress hormone. Short-term cortisol spikes are protective. They help you handle acute threats. But chronic cortisol elevation has a well-documented suppressive effect on the immune system, specifically on T-cell activity and natural killer cell function. The very cells that suppress HPV. This is why so many people notice a wave of new skin growths during or immediately after a prolonged period of stress. The stress did not introduce a new virus. It lowered the immune suppression that was keeping the existing virus quiet. Research published in Brain, Behavior, and Immunity has shown that chronic psychological stress in adults over 55 is associated with measurably reduced natural killer cell activity, and that this reduction correlates with increased viral reactivation across multiple latent viruses, including HPV-related manifestations. The most accessible and evidence-supported stress intervention for immune function is diaphragmatic breathing with an extended exhale. Here is the exact technique. Sit comfortably with one hand on your chest and one on your belly. Inhale slowly through your nose for a count of 4. Your belly should rise more than your chest. Pause for a count of 2. Then exhale slowly through your mouth for a count of 6. The extended exhale is what activates the parasympathetic nervous system and reduces cortisol. 5 cycles in the morning and 5 before bed. That is approximately 4 minutes total per day. Research in Frontiers in Human Neuroscience has documented measurable reductions in cortisol and improved natural killer cell activity with consistent slow breathing practice over 4 weeks. Now, I want to tell you about a patient whose experience makes all three of these mechanisms impossible to ignore. Barbara was 63 when she came to see me. Over the previous 18 months, the skin tags on her neck and under her arms had gone from a handful to more than 30. She was embarrassed by them. She had tried removing several at home with mixed results. When I took her full history, three things stood out immediately. Her diet had shifted significantly after her retirement 2 years earlier. More convenience food, less variety, almost no seeds or fermented foods. She had been on a proton pump inhibitor for acid reflux for 3 years without review, and she had been her mother's primary caregiver through a long illness. 18 months of disrupted sleep, chronic worry, and emotional depletion. Three immune system stressors running simultaneously for the same 18 months her skin had been changing. We did not treat the growths directly first, we addressed the system. Zinc-rich foods reintroduced daily. Fermented foods added 3 times a week. Her acid suppressor reviewed with her gastroenterologist, the dose was reduced. A simple 4-minute breathing practice morning and night. And gentle daily movement to support lymphatic circulation. Within 6 weeks, no new growths had appeared, for the first time in 18 months. Within 4 months, several of the smaller existing tags had softened and reduced. Her dermatologist at her next annual check commented that her skin had noticeably stabilized. And now, the part of this video I have been building toward, because supporting your immune system internally is the foundation. But there is one specific external approach that most seniors have never been told about, and it changes what you do next. The most important thing I want you to know before you do anything to a skin growth is this. Not all growths are the same, and treating the wrong type with the wrong tool causes more harm than doing nothing. There are 3 categories you need to distinguish. Soft, flesh-colored, dangling tags on thin stalks. These are classic papillomas, typically HPV-related. Firm, rough, slightly grainy growths on hands or feet. These are common warts, also HPV-driven but different subtypes. And waxy stuck-on brownish flat patches that appear on the trunk and face with age. These are seborrheic keratoses, not viral, related to sun exposure and skin aging. Before applying anything, use this 3-second check. 1. Color. Is the growth one even tone? Uneven color, dark patches, red areas, near black zones, means stop and see a dermatologist before doing anything else. 2. Border. Is the edge clean and clear? Ragged, blurred, or spreading edges mean the same. Professional assessment first. 3. Change. Has it grown, changed shape, or altered in the last 3 months? Yes means get it checked. If all 3 pass, you can consider conservative home care. For soft tags and papillomas, the gentlest and most appropriate starting option is plain castor oil. It is rich in ricinoleic acid, which has anti-inflammatory and tissue-softening properties. Apply a small drop directly to the growth twice daily and cover it with a small bandage to maintain contact. This is slow, expect 2 to 4 weeks before any visible change, but it is safe and carries essentially no risk of scarring or worsening. For firm, thick warts on hands or feet, salicylic acid is the first-line evidence-based option listed in guidelines from the American Academy of Dermatology. The protocol: soak the area in warm water for 5 minutes, gently file the surface with a disposable emery board, apply salicylic acid product directly to the wart, protect surrounding skin with petroleum jelly, and cover with a bandage. Repeat daily. Results take weeks to months. 3 months is a reasonable minimum before assessing whether to escalate to a clinical procedure. What you should never do: do not cut, tie off, or tear growths at home. Do not apply concentrated vinegar or plant saps directly to the skin. Do not use the same treatment on every growth regardless of type. Each of these mistakes can cause chemical burns, scarring, infection, or spread the virus to surrounding skin. Outcomes far worse than the original growth. And for any growth on the face, eyelids, or genitals, no home treatment. These require professional assessment and clinical management without exception. I want to hear from you. Have you noticed skin tags or warts multiplying after 60? And when did you first notice the change? Was there a period of significant stress, illness, or dietary shift around the same time? Drop it in the comments below along with your age. The pattern I see in the comments shapes the next video I make, and you may find that someone else's story mirrors yours exactly, which is often the most reassuring thing of all. You are not alone in this, and your skin is not failing you. It is communicating with you. Now, if you want to understand what is actually happening to your immune system's deeper defense mechanisms after 60 Astena beyond skin and beyond HPV, and what you can do to slow immune senescence at the cellular level, that is exactly what I cover in this video right here. Watch it next.